The big reward for all your input and the actions which will improve your lifestyle is that you will be able to manage your health. Therefore, if you are truthful with yourself and really follow the guidelines and key messages as outlined in Part 2, you can expect to manage your daily well-being, taste bud preferences, nutritional profile, body fat and waistline, lifestyle diseases, and ultimately, also your budget. Let us first focus on the day-to-day changes that you can look for within the first 5 to 10 days. No more tiredness, energy dips during the day, bad dreams or nightmares, inappropriate mood swings, unnecessary anxiety, stress, or panic attacks. No more blood sugar-related headaches or unhealthy cravings, not even for the chocoholic. Imagine waking up rested, chirpy and ready for the day, being able to concentrate far better and getting your work done. Lots of sustained energy, vitality, perseverance, and stamina. Changing your taste bud preferences is one of the most amazing rewards that you can get when you follow these guidelines and key messages. Within 2 weeks, you will find that healthy food choices, which you resented in the past, actually taste great. You will no longer have sweet or savory cravings, but will learn to enjoy the natural flavor of food. The only way I can convince you of this amazing reward is for you to try it yourself. Changing your dietary patterns as outlined in Part 2 helps you to manage your own nutritional profile. In the long run, you will balance all the nutrients your body needs. The correct type and amount of fats, good quality protein sources, wholesome sources of starches as carbohydrates, ample dietary fiber, and lots of vitamins, minerals, phytochemicals, and antioxidants, all of which will help combat the destructive metabolic cycle. For many traditional dieters, the bathroom scale determines their mood for the day. When the weight is up, the mood is down, and vice versa. As mentioned before, the scale does not reflect what really goes on in the body. Look out for looser fitting clothes, adding a notch to your belt, and measuring your waistline at the level of the navel. Any change in your waistline is a bonus. It points to loss of body fat. The management of disease and ill health is a long-term reward. When you follow your new lifestyle plan, you can expect any of the following. Children or grandchildren with attention deficit and hyperactivity will have greatly improved concentration, and their behavior will be much more acceptable. This is, of course, if the guidelines are met, which demand a lot of planning from parents or grandparents, as well as caregivers. No more painful gout attacks. Gout is often referred to as the disease of feasting and fasting. When you follow the guidelines, no more feasting or fasting takes place, and your chances of getting a gout attack are very slim. No more constipation and relief of discomfort and pain associated with irritable bowel. A healthy gut is essential for a healthy body. It discards all the unwanted toxins from your body. If it does not function properly, it reduces your body's immunity, and you can develop serious autoimmune diseases and cancer later in life. Sufferers of sinusitis and recurrent nagging urinary tract infections will experience great relief from the frequency and intensity of infections. White blood cells that protect you from infections can no longer be paralyzed by high blood sugar levels, and therefore you are less prone to inflammation such as sinusitis, common flu, any inflammation in your joints, colon, or gallbladder. Emotionally, you will feel uplifted and not depressed anymore. With increased insulin sensitivity, more serotonin is produced, and hence the improvement in your emotional well-being. Women with PCOS can experience less body hair overgrowth, regrowth of your hair, and less acne. Those who wish to might just fall pregnant. It will take about 8 to 12 weeks during your new venture to achieve a healthy, well-balanced lifestyle before you can expect the next changes. Elevated blood pressure and cholesterol levels will go down. You might even, with the help of your doctor, reduce your prescribed medication. If you have diabetes, your blood sugar control will be much better, and consequently your chances of developing long-term complications of diabetes, such as blindness, gangrene, kidney failure, and heart disease, will be less. Your chances of developing stroke and/or deep vein thrombosis will reduce dramatically. As an ultimate bonus, you can also manage your health budget by cutting costs. When you adhere to the guidelines, you can reduce the years of prescribed medication use, reduce the number of visits to the doctor, and reduce the number of hospitalizations or surgery. Furthermore, you don't have to take off work or turn down promotion at work because of ill health. Reap the benefits of an improved lifestyle.